Welcome, everyone. Thank you for joining us all today for our virtual town hall hosted by the Children's Environmental Health Network. At this time, I'm going to hand the floor over to Nsedu Obit Witherspoon, our executive director. She's been with the Children's Environmental Health Network now for 20 years, and she serves as a key spokesperson for children's vulnerabilities and the need for their protection. She is a past member of the NIH Council of Councils, the NAS Environmental Health Sciences Roundtable, and the Science Advisory Board for the Centers for Disease Control and Prevention. Currently, NSE sits on the External Science Board for the Environmental Influences on Child Health Outcomes, NIH research work, and she is a co-leader for the Science and Health Initiative of the Cancer-Free Economy Network, which is a leader in, and she's a leader in the Lead Service Line Replacement Collaborative, and she co-chairs the National Environmental Health Partnership Council along with Amanda Reddy, one of our panelists today. She is also a board member for the Pesticide Action Network and the Environmental Integrity Project, and was appointed 2 terms to serve on the Maryland Children's Environmental Health Advisory Council. So NSE is our moderator for the Lead in Drinking Water virtual town hall series. And I'm now going to hand it over to you, NSE.
Thank you so much, Christine. I definitely want to thank Christy, Hannah, and Alyssa at our team for just putting all this together and doing a fantastic job. Good morning, good afternoon, everyone. Thank you so much for joining us. We really do believe this is going to be a great series, and we're so grateful for our wonderful partners, which I'll talk about in a minute, and our fantastic speakers. Again, this is a 3-part series for public health professionals in particular, but certainly anyone I know is going to get a lot out of this as we all collectively work to address lead in drinking water as part of a comprehensive approach to lead poisoning prevention and health equity for children, and certainly all, but most especially our most vulnerable populations. For those that don't know, the Children's Environmental Health Network is a national nonprofit. We are almost 30 years old ourselves, and we've been working from day one to ensure that all children have the safest and healthiest environments to grow in. And lead prevention has continued to be one of those cornerstone, most historical issues that we are still dealing with today. Much better than the past for sure, but we really need to get over the finish line when it comes to truly protecting everyone, pregnant women, children, from preventable lead hazards. I also want to give a big thank you to the Lead Service Replacement Collaborative and the National Environmental Health Partnership Council and their great collaboration on these series as well. So I'm going to jump right in because I know we want to get to our discussion and just introduce our fantastic speakers today. Providing an overview of the need to be comprehensive when we are dealing with lead prevention and looking at various sourcing is Amanda Reddy. She's the executive director of the National Center for Healthy Housing, an organization that is founded on the premise that better housing can be most powerful. Can be a powerful platform for better health. She joined the organization in 2012, so she's celebrating 10 years herself, which is exciting. And she's a great friend and colleague and leader for us all. She has advanced numerous initiatives, including those related to healthcare financing of healthy home services, training, and technical assistance to support the launch and the growth of sustainable healthy homes, and the development of indicators for the HUD Healthy Homes Index. Prior to joining the National Center for Healthy Homes, Ms. Reddy was a research scientist with the New York State Department of Health, where she provided program evaluation, management, and technical support for the asthma control, healthy homes, and lead poisoning, primary prevention, healthy neighborhoods, and the healthy homes environments for New Yorkers with asthma programs. She holds an MS in environmental health from the London School of Hygiene and Tropical Medicine and a BA in neuroscience from Mount Holyoke College. Then after Amanda will be Dr. Mona Hanna-Attisha, and she'll be providing a clinical perspective for us. She is the founder and director of the Michigan State University and Hurley Children's Hospital Pediatric Public Health Initiative, an innovative and model public health program in Flint, Michigan. So as a pediatrician, a scientist, an advocate, an author, she has testified 3 times before the United States Congress, a frequent contributor to national outlets, including the New York Times and the Washington Post. And she's appeared on CNN, MSNBC, BBC, and countless other media outlets as she continues to work tirelessly daily to champion the causes of children in Flint and beyond. She is the founding donor of the Flint Child Health and Development Fund, known as flintkids.org. And as a COVID-19 survivor herself, Dr. Hannah Atisha has donated her plasma, her convalescent plasma, 3 times while continuing to advocate for health and racial equity. And I'll also note that she's a past Children's Environmental Health Advocate Award recipient. And then finally, we have a fantastic team from Paterson, New Jersey that will be providing a case example for us and highlighting some of their resources and practices. Jean Mugalusi is the Environmental Health Coordinator of the City of Paterson Division of Health in New Jersey. With 18 years of experience as an industrial hygienist, a registered environmental health specialist, and a lead inspector risk assessor, she has played an integral role in the City of Paterson's lead poisoning and occupational lead exposure prevention efforts. The pandemic and the events that followed allowed her to become a COVID-19 case investigator, as well as overseeing the creation of a lead safe registry using GIS mapping technology to indicate properties that are newly constructed or have been inspected and found to be lead safe. She's currently the program manager for the City of Paterson's newly acquired lead hazard reduction demonstration grant from the Department of Housing and Urban Development, which seeks to help low-income homeowners and tenants obtain the remediation lead hazards in their homes and to provide children with a safe and healthy set of housing options. Also on that team presenting is Joya Jenkins, a lead inspector risk assessor for the City of Paterson's Division of Health. With over 12 years of experience as a lead inspector risk assessor and 15 years in public health, she has seen firsthand the effects that childhood lead poisoning has had on children and within the community. A married mom with 2 daughters, ages 15 and 1, she understands the importance of keeping homes safe from lead hazards, especially those that are not visible to the eye, such as lead in pipes and lead dust. And finally, part of the team, Alicia Espinal Mesa is the community liaison for the City of Paterson's Division of Health. Since joining the Division of Health's Child Lead Program team in 2019, she's helped to create educational initiatives and campaigns about lead poisoning prevention and remediation abatement. Alongside their team, she has overseen the creation of the City of Paterson's lead safe GIS map and continues striving for its improvement through conversations with community members and leaders, and as well as a constant assessment and evaluation. Working primarily with the City of Paterson's Spanish-speaking population, she works to ensure the needs of the community are at the forefront of decision-making and communication in order to provide more equitable services. So sit back, please get your notes ready, your questions ready for sure, and we look forward to starting off now with Amanda Reddy.
Thank you, Nsé. I'm really honored to be a part of today's town hall event, kicking off this series of conversations about lead in drinking water as a comprehensive part of lead poisoning prevention and health equity. We're here today because, you could go to the next slide. We're here today because despite decades of progress and an abundance of evidence-based solutions, children all over the country are still being exposed to lead. We know, for instance, that there are 37 million homes that contain lead-based paint, and 23 million of those have significant lead paint hazards, including 4 million that contain young children who have likely been spending even more time being exposed to lead and other hazards in their homes over the past year. And that there are an estimated 6 to 10 million homes with lead service lines for their drinking water. And because of both of those things, we have an estimated 500,000 young children. That's about 24,000 kindergarten classrooms full of children who have been exposed to levels of lead that will impact their ability to learn and thrive. And that doesn't even account for older children who were previously exposed and children who are being exposed to lead and whose levels may be climbing but don't yet show up in any of our surveillance data. It also masks the reality that as a result of a long history of racist housing policy, some communities are more affected than others and bear a disproportionate share of the consequences of lead poisoning. Next slide, please. At this point, those consequences are well characterized. Very high doses of lead, which are rarely seen in the US today, can cause seizures, coma, even death. But the epidemic of lead poisoning in the US is very different. Lead exposure often occurs with no obvious symptoms. So without screening, it can go undetected and unrecognized. And I think we all know that there's been a lot less screening happening over the last year. And the problem with that is there's no known safe level of lead, and children who are exposed even to these low levels of lead can suffer neurological damage, impaired memory, attention disorders, impulsivity, and hyperactivity, among other challenges. And as I just noted, some of those effects can happen even with very low levels of lead exposure, but still have lifelong consequences on academic performance, earning capacity, and more. The financial fallout from all of that affects the families and if children exposed to lead, but it also costs our society billions of dollars in public spending on special education, juvenile justice, and other services. Next slide, please. A study by the Health Impact Project at the Pew Charitable Trusts, for instance, estimated that keeping blood lead levels of children born in 2018, just children born in that year, if we had kept their lead levels at 0 and not exposed them to any lead, it would have generated about $84 billion in benefits over their lifetime. That same study found evidence that our existing interventions to reduce lead exposure, from replacing lead service lines, lead hazard control interventions, enforcing EPA's RRP rule, would also yield savings and protect hundreds of thousands of children per year. And most of you already know all of this, right? Many of you come from the public health community. So what I'd like for you to do is to just sit for a minute and reflect on what comes to mind when you hear phrases like lead poisoning, lead exposure, lead hazards. And since many of you joining today are, like me, members of the public health community, you're probably imagining something like this. Next slide, please. Chipping, deteriorating, peeling lead-based paint, which has been at the heart of the story of lead poisoning in this country in our efforts to combat it, and in the real and dramatic progress we've seen over the years in getting lead out of children's environments. Many of us have focused on paint for years or decades, and we've seen a lot of progress as a result. But it isn't the whole story, and it can't be the whole solution. Next slide, please. Lead exposure comes from different sources and pathways that include air, food, water, dust, and soil, just to name a few. And it's true that lead-based paint is still the most widespread source of lead exposure for young children in this country, but that picture or story can look different if you look at the sources for a specific community or a specific family. And paint has never been the whole story. Next slide, please. This figure illustrates the decline in mean blood lead levels over time, annotated with policies governing lead in paint. Yes, absolutely, lead in paint, but also lead in water, in air emissions, in food and children's products. We know that this holistic approach works. Look at this progress. That's why it's more important than ever to continue to look at lead exposures more holistically and to improve our efforts to look at lead exposure more holistically and implement comprehensive solutions that address the range of exposures in a given community. I know that this message has resonated powerfully with many of us in the wake of the water crisis in Flint and other communities. And as a result, many of us have been learning more about what we in the public health community can do to eliminate and prevent exposure to lead in drinking water. Next slide, please. Because I think we all agree, this is a problem we can solve, right? But we're not going to get there if we continue and persist in thinking about lead poisoning prevention as a zero-sum game, where an investment in removing lead service lines is viewed as a competition or a lack of investment in addressing lead-based paint hazards. I'd like to make the case, and I'm guessing because you're on this call today, that you would join me in making that case, that if we're serious about eliminating lead exposure and eliminating racial disparities in lead exposure, and we should be, then taking this more holistic approach is both possible and urgently necessary. The siloed approach that we have traditionally taken can also, it's not just that it's not as effective, it can also be dangerous and potentially misleading. As one example, it has been common practice to test homes for lead paint, and if none is found, or it's a newer home, or if hazards are remediated or abated, that we deem the house lead safe or lead free, when really we've only addressed one potential source of exposure to lead. That can provide a false and potentially harmful sense of complacency for a resident. Similarly, in communities where lead service line replacement is underway, residents may not realize that there are other potential sources of lead in their homes. In 2017, well into the crisis in Flint, my organization worked with a group there that was focused on translating materials about lead exposure into Spanish. And many residents shared that it was the first time, years into the crisis, that they had learned that lead exposure could come through pathways other than water. On the flip side, another resident in that community shared her frustration that near the start of the water crisis, when she asked about having her infant daughter tested for lead, her pediatrician told her that they needed to wait until after the baby was a year old and presumably crawling or walking, because for decades that has been the message in the focus. That is the age when children's exposure to lead-based paint hazards increases because they're crawling and walking and engaging in those hand-to-mouth behaviors. But we also know that children are at risk from lead in drinking water at a much younger age. And we owe it to our pediatricians and healthcare professionals to equip them with the whole story so that they can better serve their patients. A major contributing factor to these kinds of challenges, I think, is also a clue to the potential solutions. Lead in paint is typically handled by public health and housing agencies, while lead in service lines is considered usually a public works issue that's under the purview of utilities. And so as a result, there's this separation in authority, in funding streams, in messaging and understanding, and that all adds up to residents who can be left underinformed or in other cases overinformed and just inundated with information from lots of different sources, which can make them feel overwhelmed, or as I mentioned earlier, with a false impression about the safety of their homes. Or maybe they're aware of the risks, but they don't have a good sense of how to fix them. And I'll say that after spending the last several years talking with folks in the healthy housing and public health communities, a lot of us feel underinformed or overwhelmed or unsure of where to start or what our role is in addressing lead in drinking water. A few months ago, in grappling with these types of issues, I addressed the CDC lead grantees with a talk titled 10 Reasons I'm Excited About the Future of Lead Poisoning Prevention. We can go to the next slide, please. And one of the reasons that amidst all of the challenges of the last year, and they have been significant, but one of the reasons that I am genuinely excited about the opportunities in front of us to finish the fight against childhood lead poisoning is the subject of this set of town hall events, the opportunity for the public health community to, and we can move to the next slide, to leverage the awareness and interest in lead in drinking water, to look critically at some of the challenges of the new lead and copper rule, but also the opportunities it opens up, and to really take our work to the next level and finish that fight. And I think we can do it. Let's go to the next slide, please. I'm really eager to hear your ideas in our discussion today and over the next few series of town hall events about how we'll get there. But a few things that I'm specifically excited about are the possibilities of assisting our federal partners in coordinating and aligning work to better serve our communities so that we don't have to constrain ourselves to talking about paint with HUD and health outcomes with CDC and drinking water with EPA. And we're seeing this movement within key programs. And I think we have reason to be excited about what we're seeing there. We have opportunities to leverage the requirements in the new rule around lead service line inventories and the influx of interactive maps we're likely to see as a result, to not just highlight the risks associated with drinking water, which is critically important, but also as public health professionals to partner with water utilities to get the word out about lead in paint and other sources, whether through adding layers to their maps to show those risks too, to partner with them to add language to their online portals, including information about lead-based paint in their mailings to consumers. All of these are ways that we can engage residents while they are interested already, right? While they're already on the website, to streamline that experience for them, and to recruit water utilities to be a partner in spreading the message about lead poisoning prevention instead of viewing them as a competitor for attention or resources. As I mentioned earlier, I'm also really encouraged that in meeting after meeting this last year, I'm hearing more direct commitment to addressing root causes like systemic racism and sharing of lessons learned about equity implications of policies so that we can know better and do better to have our policies help and not unintentionally harm the communities that we serve. And I think an important part of that means that we are also talking more and more seriously about primary prevention and eliminating lead exposure and rejecting a model that says we have to wait for children to show up with an elevated blood lead level before knowing that there is lead in a house or lead in their drinking water and taking action to remove it. And there are new decision makers at every level of government that we have an opportunity to educate about this issue, to make new champions for this issue, and to help us get this work done. And I think it's worth noting that this issue has always and continues to resonate across both sides of the political aisle. So that's true regardless of whether you live in a red state, a blue state, a purple state. And we have a lot of great data and tools to help make that case. Those of you who know me or who are familiar with my organization know that I could probably do an entire town hall on those tools, but don't worry, I'm gonna not take up our time today. I'll just highlight one here that is worth checking out for state-specific information about the impact of some of these key policies, and that's valueofleadprevention.org, created by our partners at Alterum. And finally, we've got all of you on our team. You're here today because you're also passionate about getting this work done, and because you likely have your own ideas and success stories and challenges to share. And I'm really excited to hear from you today and over the course of this series. Next slide, please. I'll just conclude by also acknowledging that there are also some groups at the national level working to support the public health community and taking on some of these new challenges. And we can chat more about them if we have time during the question and answer period. Next slide, please. But for now, I will turn it back over to Nsé and the other panelists.
Thank you so much, Amanda. And your first slide in particular, very eye-opening, and I look forward to the discussion. I know a lot of folks are already asking if slides will be available, so fantastic way to set us in the foundation here. And now we'll move on to Dr. Hannah Atisha. Welcome.
Thank you. Thank you, Nsé. It's great to be part of this panel, and I don't think I need to say anything else, Amanda. That was awesome. Amanda covered everything and really kind of where we need to go. I'll just share a little bit about kind of my personal experience and why we all have to open our eyes to the issue of lead and water. So I started out my career in medicine in a very non-traditional way. I started out as an environmentalist. My focus was really in environmental health. As an undergrad, I did bench research and reproductive toxicology. So my roots are in environmental health, and that's what pushed me to go into medicine and ultimately into pediatrics, where recognizing that, kids are the most vulnerable to environmental exposures. So, have this background in environmental health, also have a degree in public health, and practice both in Detroit and Flint, and currently still continue to practice in Flint for decades. And, I have probably cared for hundreds of children with lead poisoning. And when I was still, a younger physician, there wasn't a day that went by that we didn't actually have a patient or several patients admitted to the hospital because of really high levels of lead poisoning that needed medical therapy. So lead poisoning was bread and butter pediatrics, something that we, took care of every single day, something that we increasingly understood the science of, especially as I progressed through my training, that, there is no safe level of lead. And whenever I would care for a patient with lead poisoning, admitted or not, we would go through this really long investigation, and it was like a sleuthing exercise. Like, where is this kid getting their exposure to lead from? And we'd ask, important questions like about the age of the home and, where they spent most of their time, and did they have a lot of kind of pick-up behavior? Did they put a lot of things in their mouth? And did they play with all these weird toys? Where, was there, like, what was the home condition like? So, did the foreign makeup, like all these crazy questions to determine where this patient in front of me was getting their lead exposure from. And never in my decades of practice before Flint happened, did I ever think about water. And this is coming from a person who has an environmental health background, trained in pediatrics, a public health degree, and I never knew that there was the potential of lead in water. And that obviously that all changed for me, and really that changed for the nation after Flint happened. And the title of my book is What the Eyes Don't See, and it refers to a saying that the eyes don't see what the mind doesn't know. And my mind didn't know about the possibility of lead in water. And because I didn't know, I didn't see it in my patients, and I wasn't caring for them as best as I should, nor caring for a population of children. And then as I, became immersed in the Flint water crisis, I began to learn a lot more about the possibility in lead in water. And I really felt so terrible that I had missed this diagnosis for so long, and that I did not know about lead in water. And there's things that I came to learn about that I just I kick myself. I'm like, and you guys probably know this now as well. So what's the elemental symbol for lead? And I'll put it in the chat. You guys all know this. What's the elemental symbol for lead? I'm gonna wait a couple seconds. We're gonna try to make this as interactive as possible. So the periodic table of elements, the symbol for lead is, oh, there we go. So, okay, you guys got it. Oh my God, now it's exploding. Okay, so the symbol for lead is Pb. And that comes from the Latin plumbum, which means plumbing. So the word lead actually means plumbing. And I didn't know that. I didn't know that lead meant plumbing, and that for centuries we've had lead in our plumbing, and for centuries we've seen its ill effects. The Romans built their aqueducts out of lead plumbing, and if you go to places like Pompeii, you can see these perfectly preserved lead pipes. And this strong theory is that hypothesize the demise of the Romans is because they had all this lead in their plumbing. They also put lead in their food as a salt and additive, so lots of bad things, don't do it. But we've known about the evils of lead for a long time. And we've known about the evils of lead in plumbing for a long time. I was actually born in Sheffield, England in the 1890s. In Sheffield, England, they had a lead and water disaster, a lead and water crisis. And they noticed that a lot of the pregnant moms lost their babies. Because of that, one of the first abortion pills that was created was a lead-based pill. Because of that experience, and there's articles in the British Medical Journal about the use of lead-based pills to induce abortions. So there's lots of great resources to learn more about lead and water. This is Flint definitely brought this to the national spotlight, but it wasn't the first lead and water crisis, and unfortunately, it wasn't the last lead and water crisis. Other things that I have learned, over time is that, lead and water, all lead is bad, all lead is evil. When I heard about the possibility of lead being in the water in Flint, that's the moment that my life changed, because I respect the science of what lead does. We know how it impacts cognition and behavior, and it has these life-altering consequences. And we also know that lead is a form of environmental racism. I learned that 30 years ago as an undergrad. Kids in Flint, kids in Detroit, kids in Chicago, Baltimore, Philadelphia, you name it, some of our most vulnerable kids who are already rattled with so many toxicities in life are also more likely to be exposed to lead. So it was respecting the science of lead and understanding its role as an environmental injustice that propelled me to see what was happening to our children in Flint. And then I also began to understand how lead and water is a little different than other sources of lead. Our surveillance systems, and Amanda touched on this, our lead surveillance systems that we have set up we screen kids for lead at the ages of 1 and 2, and that was developed because of the high risk of lead exposure from household lead. That's when kids are developmentally walking, crawling, they put everything in their mouth because that's how they explore their world. But that's when they're at risk for lead paint and lead soil and other and dust. That's why it was developed at those ages. And lead and water impacts a different age group, a younger age group, a more developmentally vulnerable age group. It crosses in utero. It's especially, terrible for babies who are using water for formula, for reconstituted formula. And those aren't the ages that we screen kids for lead and water, for lead in their blood. So we really don't even know what the extent of the exposure is, because the surveillance data that we have is surveillance data because of these household risks. Of all the sources of lead, paint, dust, soil, you name it, lead in water is also unique in that it's in a vehicle meant for ingestion. Like, we are meant to drink water. Like, it's a public and medical, public health and medical necessity. We have to have water to survive. Yes, kids eat soil and dust. They're not supposed to, but they do because they're, curious. But unlike those sources, water is meant to be ingested. And yet here we are, because of our long-standing inability to respect science, and the power of the lead industry over decades, and this could be a whole 3-hour other presentation. We were stubbornly slow as a nation to restrict the use of lead in many sources, but especially in plumbing. And it wasn't until 1986 did we restrict the use of lead in our service lines, which are the pipes that go from your water main to the front of your house. Most communities had stopped using lead service lines, except like Chicago was still putting in lead lines in 1986. And in many communities, if you wanted access to water, you had to use lead lines. It's actually written in code that there was no other source you could use besides lead to get your drinking water. But there's also lead in premise plumbing, which is the plumbing that's inside your house. And for example, in fixtures and faucets, and that wasn't restricted, for example, from brass fixtures until 2014. So this is really, really recent. So there is lead really ubiquitous in our drinking water delivery system. Some communities, as we know, are more impacted than others. And in those communities, they also often have the other synergistic impacts of lead from paint and other industrial and legacy sources as well. So I just want to kind of end by just having us all think. So if we know, and we really know that lead is a poison that has no safe level, that causes these life-altering consequences, why does it continue to be the straw that is delivering our drinking water? So, we are at this amazing opportunity right now. Just like Amanda, I am so hopeful. I am so excited. There is so much that we can do, and that we must do, especially now with the lead and copper rule kind of being reopened for public comment, to truly focus on primary prevention and eliminate ongoing lead exposure. And like Amanda said, like, this is not a shrug your shoulders kind of thing. We can do something. We've known for a long time we can do something. I want to read one of my favorite quotes from 1969. Rene Dubos, a scientist who was talking about lead poisoning, and he said, "The problem is so well defined, so neatly packaged, with both causes and cures known, that if we don't eliminate this social crime, our society deserves all the disasters that have been forecast for it." So it's past time that we eliminated this social crime.
Oh, that says it all. Thank you so much, Mona. Appreciate that. The questions are coming in. This is great. We're just going to allow our next team to present first and make sure that everyone is able to share their prepared comments. And then we're definitely going to leave some time for this engagement. So thank you so much. And now our Patterson team.
Hi, everyone. Okay. We can jump to the next slide. So this is pretty much our child-led team, which is comprised of inspectors, nurses, and our community liaison. And on the left is our health officer. Next slide.
You can actually get their names. And those are all of our names if you ever need to get in contact with us.
Right. So the first slide basically is our lead ordinance that we have within the city. So we do what's called a city lead inspection. And a city lead inspection basically is used for disclosure purposes so that the homeowners and landlords can notify the potential renter if there's lead present in the home. So we work with Section 8, which is the subsidy rental program. They also will not approve their application, and they won't approve it if the home has lead present. So if they're renting to a child, let's say under 6, if there's lead present in the home, they will not be able to move forward with the rental application. We've also collaborated with our building department. they will not issue a CO, which is the certificate of occupancy, to any home that has not had a city-led inspection prior to applying for their CO. We can go to the next slide.
Just to provide you all with a little bit of context about Paterson and what our city looks like. In Paterson, we are the 3rd largest city in New Jersey. Many of our homeowners are low-income homeowners, and many of our dwellings are multi-city. So being that our city is in close proximity to New York, we also have a lot of people living in our city, and just like many of our multi-dwellings. So what we have on the screen right now showing you all is this GIS map that our city had created. Originally, the map's layers were things like flood zones and historic districts and all kinds of things that you see on the side. So our vision, once we realized we have all this data for all of the inspections that we do, but it's not being shown to our residents, it's not being shared or shown to potential renters, potential home buyers. Our vision for it was to show what this map could look like if it showed our residents what the environmental hazards were that were present in our city. So with our existing map, the information was important, but we felt that it was missing an opportunity really just to give more information about environmental health hazards. We received a capacity building grant from the National Center of Healthy Housing. Amanda is actually, we worked closely with her with that, and the Robert Wood Johnson Foundation that gave us funding that allowed us to really formulate a concrete idea and work on this map and working to create it and to make it a reality. So we first began to compile the data using the inspections that Joya mentioned about from the lead ordinance, but then we also had all these certificates of new construction that our building department actually worked with us to compile that data on from homes that were built post 1978. So the main focus here was lead-based paint in homes and dust, and in some of our inspections, soil. But water was a big missing component. It wasn't something that we were able to get that data readily, only because our water company, the Water Commission, I should say, is like its own entity. So we had to really work with them to discuss different things that we could do. As has been mentioned, a lot of our focus was lead-based paint. So we figured it was better to start somewhere than to not have anything at all, just waiting. So right now, now that we've had the time to consider the map's improvements and other things that we can do, the water has now jumped to kind of the forefront. We already have this data on lead-based paint. We have this data on homes that are considered to be safe from lead-based paint hazards, but we don't have any data on water besides what the water company can give us. So that's essentially what we're working on now. They do run routine tests on different streets, and they provide us with data like the numbers that were found on certain streets, but we don't have any. They have also been replacing service lines since, I believe, the 80s or 90s, around that time. But their main focus was from the curb to the main. And so now what we're working with them on is to really get more information. They've also been replacing some of the curb to the home service lines, but we want to make sure that we can be as transparent as possible. So if we go to the next slide, we can actually show you our vision.
So our vision right now is with all the information that we've collected, all the information with the lead safe housing, our vision right now is to incorporate the houses that have had their service lines replaced with the housings, the homes that are lead safe. So we're looking to work with the water company to obtain that information. And once we've obtained that information, we want to incorporate it into our map. So it shows homes that have replaced their water lines, homes that are lead safe in new construction. We've also partnered with the school district to make sure that every child that enrolls for pre-K has been tested for lead. And if when they're enrolling, they require them to have a lead test. If they don't have a lead test, they send them back to us to make sure that that's done. So right now, that's where we're heading. We're in the process of getting in touch with the water company. We've been in touch with them. We are just working through the red tape to make sure that we can obtain all the data so we can incorporate it into our map. So that's where we are.
And as you can see, the map that's shown here is our, that's kind of where we started. This is what we have so far. The green dots that are shown are the homes that have been inspected and found to be safe from lead-based paint hazards. So those are the homes that traditionally we would call them, like, I would say, yeah, lead-free, but we've since learned, we've since learned not to use that terminology because no home can really be considered lead-free. The blue squares that you see are the homes that are new constructions. On the actual map, and actually the link, the blue lettering that says lead safe registry, that's a hyperlink. So when this slide is made available to any attendees and everything, everyone can actually click on it and you can open up the map and you can see how to navigate it. It is searchable. You can search addresses. You can click around. You can move and see where everything is. And you can see the key that tells you exactly what each thing is. When you click into the home, some of them have the years that they were built. Some of them have some data on when the inspection was conducted and things like that. So we're trying to keep everything as transparent and up to date as possible. And so this is essentially where we are. As Jean has mentioned, we do have a larger vision for this map. We want to include more information. We want to make it readily available. We want to make it more mobile friendly, acknowledging that not everyone has access to a computer. Not everyone has access to the way that this map is at the moment. So it is constantly improving. It's a project that we are not done with whatsoever, but we wanted to show you just so you see that even though it's been a process to get here, it's taken us like, I want to say like a year or so to really get a lot of this done. Actually a little bit more than that, but we still have more work to do. So this is a constant process and it's going to take some time. But the important thing is that you start, and that's where we are right now.
Thank you all so much, all of our speakers. This is great. We're going to jump right in. I'll just note that there was one question, a few questions that came in about finances, right? I mean, that's usually the elephant in the room when it comes to, especially, well, on both sides, the major issues we've traditionally had with old lead paint and those sources, legacy sources, as well as the water and the need to fully replace, not partially replace, lead service lines. And it's expensive, right? I mean, it's kind of like, driving your car before we all move over to electric vehicles and never maintaining it, or riding your bike, never maintaining it. At some point it's going to bust on you or cost something extremely ridiculous. But with that said, I just wanted to mention, please Google when you can, the Lead Service Line Replacement Collaborative. That effort is trying to work to track case studies like what we've just heard about, the great work happening in Paterson, New Jersey, and not only how some of these partnerships are happening between public health and the water utilities, but also how they're being financed. And there's many different mechanisms. It's not a one-stop, shop. Some are choosing with the buy-in of their community to maybe add on a little bit more to the water bills that over time will help. Some are getting loan programs. Some are, some of the governors or mayors, I should say, of the cities are actually really standing behind and finding money within the budget, that over a course of time, are choosing to pay for this. Again, we're trying to show on that website as many, and if you know of other examples, please provide those to us on the site. There's a way where you can communicate with us or send it to myself or Amanda or Christy. We want that site to be a public source, you don't have to pay any money to go find it, so that your cities, your mayors, your governors can get some ideas, real-time examples. It doesn't mean you can't come up with your own. And Mona, you have some thoughts on this too.
Yeah, no, that's a great question. The last time I testified in Congress was right before COVID, and it was about the lead and copper rule. And the pushback that I got from the congressional folks was the cost. Like, how can we pay to dig up all these pipes and do this, lead elimination work? And I reiterated the cost of inaction. There is a cost of not doing anything. Amanda shared that. She put the link up just now. We know that the societal costs and how it impacts kids with their health and behavioral health and education and justice issues, and the list goes, and economic productivity. There is a cost already there. So this is a cost savings when we do something, and there's a timeliness to this. The Rescue Act that just was passed is providing a lot of money to cities all over the country, and cities are trying to figure out what to do with this money. Obviously, there's a long list, but it's also an opportunity for us to be advocates right now to make sure that lead elimination is top of list. Especially as cities are trying to make sure that their lists are addressing equity and that they have specific anti-racist plans. Because if there's anything that we can do to address systemic inequities, it is to, holistically eliminate lead exposure.
I'll just jump in and say, here to everything both of you have said. To emphasize the resource that we have at valueofleadprevention.org, I shared the national numbers about that return on investment for investing in prevention, but you can get state specific information, which can be really, really helpful and powerful in making that case to decision makers. And we also have additional opportunities coming up. Those of us who are in a position to be advocates, if there is an infrastructure spending bill coming up, right? This is what better of an infrastructure investment than to invest in eliminating lead exposure through the replacement of lead service lines, but also getting lead out of homes, through window replacement and other mechanisms. I think we absolutely have reason to be hopeful about some of the opportunities in front of us right now to overcome some of those longstanding barriers.
Thank you so much. There's a lot of great questions. One in particular about concern that the public health action level creates a kind of false sense, right? That if you're under that level, somehow your child is not going to be in harm's way. We know any source of any level of lead is not safe. So the question then is, how do we really start to make sure that we have standards, policies at the state and federal level that are health-based and better communicate the available science? Feeling that threshold level is, if you will, helpful, but not obviously all where we need to be.
I can jump in. That is a great question. And it is such a common misconception that folks equate action level to health level or safe level. And it's not. And even if you look at the other EPA levels, EPA has something called a maximum level contaminant goal for lead in water. And it's 0. It's 0 parts per billion. That's pretty much the maximum of lead in water that we're supposed to have. But that's not an enforceable goal. We need to be really respecting the science and make that the enforceable goal. The American Academy of Pediatrics has issued a recommendation for 1 part per billion in schools and childcare facilities. The bottled water standard as part of the FDA is at 5 parts per billion, and I believe that's where Canada is right now. And the World Health Organization is at 10 parts per billion as their action level, but that's not even a health-based standard. So we need to combat the common misconception that the action level is a health standard, and we need to push towards respecting the science. And I would advocate at that 1 part per billion level that the American Academy of Pediatrics has set. And I would also add, the action level is based for an entire community, for a public water system. It doesn't necessarily, and it's this 90th percentile, it doesn't reflect what may be coming out of your tap. And sampling is so variable. You can sample a tap 10 different times and get 10 different results based on the time of day, the time of year. Summer it's worse, the size of your tube, the size of your bottle that you're collecting, the opening of the mouth, the flow rate, if you removed an aerator. There's a lot of nuances to sampling. So I hope that as we shift towards looking more at lead and water, we don't get obsessed with sampling, but really we focus on if there's lead anywhere in that drinking water infrastructure, then that is a concern and we need to address it.
Thank you so much. What about when we talk about the lead and copper rule, which some of the other webinars in this series will get a little bit more into that in depth because there's a lot to consider. Schools and childcare are really called out in a unique way than before, that kind of thing. But Amanda, when it comes to equity and potential barriers of implementing the goals that are outstanding, what are some comments you have maybe in that arena?
Yeah, thanks, Nsé. That is, I think, a really important question. And our colleagues at the Environmental Defense Fund have written some great blogs. I'll try to drop a link in the chat here in a minute on this topic. And one of the issues they really highlight is that we know that policies to replace lead service lines that place the burden, the financial burden of on the homeowner for full replacement, that when there is that requirement for the homeowner to pay for all or part of it, that really tends to accelerate replacement in wealthier and whiter communities and to leave low-income communities and communities that have higher proportions of Black residents behind. And the final rule, unfortunately, does allow for those partial replacements when a property owner is unable to pay for their replacement on their side. So that not only that causes a lot of problems, right? First of all, the partial replacements we know can cause a real dramatic increase in the short-term exposure, and it doesn't then afford the residents in those communities the protections that the longer-term protections of full replacement. So I think that that's something that really highlights the need for state and local action here, right? We have what the rule governs, but we're allowed to supersede that and do more. And so I think that there are some great tools out there, right? You mentioned the Lead Service Line Replacement Collaborative. We put a link in the chat here. That's a great place to get tools and case studies to figure out how communities are getting this done. I'd also like to highlight a report that was issued by the Joyce Foundation. They convened a lot of stakeholders and thought leaders a couple of years ago to create a set of recommendations for state and local folks who are looking at policy development to consider how we can best develop and implement policies that really put equity at the center and how we can really make sure that we are looking for opportunities in a public health community. I think we have an obligation here to make sure that we're at the table to provide that guidance, to be that strong and consistent voice to make sure that health equity is advanced and not undermined by this rule as it is implemented across the country. So I'll drop some of those links in the chat here, and I'm sure you'll share them as the follow-up. But I really do think there is an opportunity for state and local action here to make sure that equity is centered as we move forward.
Yes, thank you. And for our team in Paterson, New Jersey, do you all know of any other mapping efforts being taken on by other parts of the country or other cities that you're aware of? Or I believe you all are breaking some ground here.
No, we're not aware of anything. No one has reached out to us to let us know if they're doing anything like that. No.
Thank you so much. Let's see, we've got a lot of good ones here. What about, okay, a lot of us in public health have been, none of us wanted to be here clearly in the pandemic, but yet now everyone in this country and around the world understands what the impacts of COVID have and continue to be on our lives, even though at varying levels, right? What about when we're talking about the impacts of COVID on this issue here? How would we like to, I know some of you kind of talked about that in the early, but let's just be very clear, right? Whether it's this or many other harmful exposures to children, this as one of the longest standing, Mona, I think you went into everyone's gone into the long history. We've known about lead probably the longest. It's been documented. There's no new science that ever needs to come out to show us how bad this is and how it should not be included in food. It should not be ingested. It should nothing. But what do we want to say when we talk about, what this year alone has further only exemplified when it comes to our need to get serious about lead prevention?
Go ahead, Amanda. Okay, I'll go ahead real quick. So there's a lot of intersections between lead and COVID. So as Amanda shared, screening rates have gone down tremendously because kids haven't gone to the doctor, just like immunization rates and well child visits, like we're just not seeing as many kids. So that means we're not detecting as, we're not doing as many investigations, or we're not doing as many abatements. And there was a great New York Times article about this last week. But I hope that this provides us an opportunity to pivot because, once again, when we screen children for lead poisoning, it's too late for that kid. Our efforts really need to shift as much as possible into screening of environments before children are exposed. So I'm hopeful that this kind of massive drop in screening rates, we have to improve it, but I'm hopeful that also changes the conversation to how in this new era of public health and lead prevention, can we shift to doing a better job screening environments rather than children? So that's one part of how COVID has played a role, the decrease in screenings. It also put a pause on home abatements and inspections for a while. I think most communities, hopefully that's back up. In terms of lead and water, so Michigan has a model lead and copper rule. It was implemented before COVID. It does better sampling. We have a first liter sample, a 50 liter sample. We've picked up more exceedances because of that. And we're analyzing that data. And then it was early release of 2020 data, and it actually shows improvements in home lead levels. And we don't know why yet, but one of our theories is that because people are in their homes so much more, there's more flushing. So they're using their water a lot more. So maybe lead and water levels are a little better because people are in their homes more. But the problem with kids being in their homes more is obviously they're exposed to more household risks of lead. Lastly, one more COVID issue: as schools and buildings reopen, lead and water is a huge concern. My kids' school district, they can't use their water because there's lead. There's also Legionella, and don't live in Flint. Like, this is an everywhere issue. When there's periods of building non-use, you have a buildup of particulates and also opportunistic pathogens. So we definitely need to focus on, somebody mentioned it, filters. We love to kind of promote this filter first philosophy rather than kind of sampling and spending a lot of money sampling, putting in lead clearing filters, especially in places where children are.
Thank you. Ms. Jean and team, what have been some of the biggest challenges to the paints and pipes mapping project for you all? And would you have any advice for others on this call who may listen to this recording later, who also may want to try to lift this up in their cities?
The biggest challenge, Kate, well, I wouldn't call it a challenge because we already had the data. So the fact that we already had the data, it was easy. We just had to find a way of getting this data on a map. And I think that's where you must have a starting point. And the starting point really is you must have a way of collecting this data, because it's not easy. The fact that we have our lead ordinance that helped us create the data. It's not easy just going out and studying lead inspections. That would be more, you would need more manpower for all that. But because we already had this data in place and we already had the ordinance in place, it made the whole mapping thing easy for us. I also wanted to add on to the point of lead and COVID, that as you had during the COVID crisis from March up until October, right? Mm-hmm. We were doing contact tracing. Up to now, we're still doing contact tracing. So we had the task of reaching out to all the people that are tested positive. And then we realized that in the process, we realized that these are some of the people that we were reaching out for to schedule inspections for lead. So we started doing it, coordinating that if we were given cases, would find the addresses, make sure, check in our system to make sure if that address has been inspected. And if the address has not been inspected, when we were doing the investigation during the interviewing, would offer tips on how to keep the kids safe during the process. So mail them literature on lead, especially for those houses that have not been inspected. Would make sure we send them literature on lead on how to keep their houses safe.
Excellent,
just,
thank you. Yep, please,
I was
Amanda.
just going to jump in. First of all, I just want to echo everything Mona said in her answer to COVID, and the fact that it's sort of highlighted our failure of our system, that we use kids as our screening tool to find where lead hazards exist. And so, we knew that going into this, and COVID has really just highlighted the failure of that system, and really increased the urgency to shift towards this primary prevention approach. I also just wanted to say, for those who are interested in Jean's comments just now about the approach of using contact tracing to help get out the message about lead poisoning prevention, we have a little write-up at NCHH. I'll drop a link in the chat about Patterson's approach, as well as some of the other ways that lead programs around the country have been adjusting to ensure continuity of services during times of social distancing.
Excellent. Excellent. And speaking of which, what are their lessons learned between both Flint and Patterson while obviously we're all in motion? Have these cities coordinated in any way? Are there some best practices that we can be gleaning, not just from the individual experiences, but for the larger that we might want to coordinate or lift up here a line?
Well, I think we're both awesome, and kudos to the incredible work that is happening in Patterson. I love the synergy and the mapping and using data to drive this prevention work and the contact tracing and doing that. It's so cool. You guys are doing amazing, awesome work. So everybody working in this field is awesome and amazing and has been doing it for a long time. So I'm just kind of really inspired and so hopeful. I think the lessons of Flint and Patterson and really all over are, longstanding lessons of kind of what are the consequences when we don't respect science, when leadership and policy doesn't value public health, when we've chronically disinvested in public health infrastructure, and when we haven't really focused on inequities. And I think, in both of our stories and in all of these stories as an opportunity moving forward to finally have leadership that values public health, to robustly support the infrastructure and what keeps people healthy, to put equity at kind of top of list, and to finally respect science. Like, how many more centuries do we need for knowing lead is bad to finally do something about it? So, I'm just really excited about these synergies and the opportunity that we really all have right now.
Yeah, thank you. And again, the elephant in the room, what would we've again been mentioning in our different discussions here, but if someone was to ask, what do we see as the biggest challenges for public health addressing comprehensive lead prevention, and throwing costs out for a minute, what would we also like to lift up here, considering we may again have some newer opportunities with the relief bill and additional capacity and some support at the state levels? I'll call out one real quick that the Lead Service Line Replacement Collaborative has been able to identify, because some of us sit on there. At times, there is not as much of effective coordination between our water utilities, for example, and our public health departments. And that is not at all a slant. It's just everyone's working so, in a very busy way. It's very common where sometimes within one agency, one office doesn't necessarily know what the other office is doing. So I guess the question then remains, how can we collectively help? We're trying, for example, in this series to help bridge the gap, but how do we collectively in our communities bridge the gap between our public health leaders who have a lot, even pre-COVID, to deal with, as well as our water utility leaders, and helping each understand each other's role better, and helping each other be able to communicate much more effectively. That's one, right? To even allow ourselves to have the data available to then populate, ideally, a map of these sorts that Patterson is doing in every city. That would be ideal on so many levels, but that's just one that I know has been teased out, and it was very eye-opening for me in public health to even realize that was such again, generally speaking, fragmentation of our systems. But other thoughts on that?
Sure, I'll jump in and say and echo that. I sit on the lead service replacement collaborative with you, and one of the things there that we hear from the water utilities who are part of that collaborative, and those are water utilities who are really open to this and care and are committed to this, is that they want to do the right thing, but they often don't know where to start. Like they don't know who to reach out to or how to reach out, and I think we see some of that on the public health side too. But there are lots of water utilities out there who want help thinking through how do they target services, what kind of messaging do they need to be putting out there, how do they get a more holistic message out there. So I think they do need our help and our guidance. I think in many cases they do want it, not all, right? There are exceptions to that, but I do think that that's true in many cases. But I also think they need our patience too. And we probably need some patience from them. And I share that because, when I work with communities across the country, sometimes I hear public health agencies who are like, well, we tried meeting with them, once, but it never went anywhere, or we ran into these, challenges or questions. And then that's it, right? And then sort of the story and the culture becomes, we tried it and it didn't work. But I think, in stories like Patterson, in Flint and other places, when you talk to the folks there on the ground and really understand, it really means that folks haven't given up after that first meeting. They've tried to find common ground. They've found people who are willing to, learn the language of both sides and serve as a bridge between those two communities to work together. And that patience is hard to ask for. Kids' lives are at stake. We want action right now. But I think we can use that urgency to fuel our energy into finding that bridge. And I'll also offer up and say, hopefully I'm not speaking out of turn here, that many of us on the lead service line replacement collaborative are totally willing to be that bridge, right? People like Nsé and I who come from the public health community have had to start to understand and speak some of the language and understand the culture on the water utility side. And similarly, we have folks from water utilities who've really embraced trying to get to understand the public health side of things. So reach out, right? And if we can be a resource and help to be a bridge and get some of those conversations going in your community, we're here and we're happy to be of service.
Definitely. I mean, that's the purpose, right? We all here as connectors, as part of this whole infrastructure here. We and to the earlier comments on economics, we need more, right? But there have definitely been health economists that have been to many of our tables that have made it very clear these formulas, funding and capacity and prevention way outweighs the costs that Mona was talking about. Costs, days off from school, appointments, medical costs, social costs, on and on, family costs, the cost of not being able to engage in your society as you might want to, the education costs, on and on and on. We can't even really wrap our head around what that means for one child throughout their lifetime if we could have prevented this exposure, or at least definitely we need to prevent, and at least severe cases for sure. But that's where we need to go, complete prevention. I also just want to get into the schools a bit. Again, our next April webinar will focus a little bit more on early learning in schools as it relates to the lead and copper rule. But Hannah, who's had some great questions up here today, says that, or is asking about, what about looking at water management plans for schools and reducing risk of lead exposure? So I do want to mention the Children's Environmental Health Network and the Healthy Schools Network and the Learning Disabilities Association all came together a few years ago and put on a meeting in DC. And it was very surprising to all of us that it was a topic around lead. And we thought we were just going to be advancing the discussion. No, it was really the first time that K through 12 and early learning providers had actually come together for a multi-day meeting to exclusively talk about preventing lead exposures in their places of learning. And it was beyond my understanding. So it just reminded us again, we cannot take anything for granted here and just assume. Again, these are entities that have a lot to deal with when it comes to health and safety and well-being of young children, of course. But to be fair, this discussion hadn't really been bridged with them in a formal way. So we've done that. What we'll make sure that we do, if we can get it, we'll put it in the chat box, we'll put it in maybe out. We have a report that came out of that meeting that you all may want to lean on. It has a variety of different recommendations, and certainly an effective management tool, a plan needs to first be identified, and key influencers and leaders in each community, including the school board and whatnot, need to be involved. If people need to understand why this is an issue, fine. There are many of us that will, can do that. The education needs to be understood so that we can act. But the whole point is this is urgent. We can't keep going on years and years and years. And so I will also say the Healthy Schools Network coordinates a whole Healthy Schools network, national network. They've been very active during COVID, even before, but specifically with reopening of schools. Many of us have been a part of these conversations, ventilation issues, and other important environmental issues like traditional lead exposures. So yes, these are issues that have been around. It's amazing to me in 2021, I think, and a lot of us, that we're still actually talking about them versus acting on them, but that's all right. I mean, there's always an opportunity. We have an administration that really does care about these issues. We have an EPA administrator that really does care about children's environmental health. So I think there's nothing but opportunity for all of us to lean on each other and best practices. And also, Joan had put in a great resource in the chat if you want to check it out. She says that Michigan has addressed the school shutdown issue. And so there's a link there to that. There's some great resources that you all are posting. Thank you very much. And then there was a question from Randy. So any thoughts about how currently the proposed EPA lead and copper rule, what our response is? What do you all think? Have you had a chance to really dive into it? And then are there any thoughts in regards to how to treat galvanized lines downstream of previous lead connection lines because of potential lead particulates? Wondering if anyone has had a chance to wrap your head around that one. Or just general comments on the lead and copper rule as well. We haven't given y'all a chance to do that yet.
So real quick, and I know that you guys have a whole session on the lead and copper rule as well. So it was great to hear that it's been reopened for public comment. So the rule was finalized in January 2021 under the last administration. And it was, I think, a week ago, paused and reopened for public comment. And I think Mary Ann put a link to that. So the new rule has some good things in it, but it was really a missed opportunity to really focus on the elephant in the room, which was the lead pipes. So it did not mandate replacement of lead pipes and actually slowed the rate of replacement. So I would love the new rule to include the mandate to replace lead pipes. They also removed the 1st liter sample. They added the 5th liter sampling, which is good because that better gets at the contribution of lead from lead service lines. But they need to put back the 1st liter sample because that really helps garner the contribution of lead from premise plumbing as well as any particulates in the system. I think those are kind of my biggest issues with the revision. But the biggest one is not mandating replacement of lead pipes. Michigan has a model lead and copper rule, which in the next 20 years, we will remove all our lead pipes. We have the 1st and 5th liter sample. We have an inventory, lots of great things that I think can really prove that, hey, we can do this and we actually get different information and more people are aware. And some of these best practices can be adopted nationally.
Certainly. It's just so empowering to be on a call with so many public health minded folks. Look at the chat if you haven't. We are trying to save what we can. There are amazing resources and links, some examples. Please do check those out. Thank you everyone for being so participatory. It really is helpful as we're all trying to do our best here to expand our reach and keep ourselves educated and motivated and informed, right? So before I wrap up here, I just wanted to ask, do any of our presenters have any final comments you want to add? Something you just want to make sure, even in the past discussions in the last couple of minutes, that you wanted to get out?
I'll just I put 2 things in the chat here, just additional resources for people to know about. I really appreciated the conversation about school and childcare environments. And, I come from the National Center for Healthy Housing, and just worth pointing out that homes are often early childcare environments too. A huge proportion of children receive their childcare in home and residential environments. And sometimes those folks can feel sort of in between. They're not just residences, but they're not necessarily center-based care. CEHN, my organization, and the National Association of Family Childcare have put together a toolkit to address the needs of that particular audience. Including a whole set of resources around lead in drinking water, but also lead in soil, lead in paint, lead in consumer products. The link is in the chat there. And for folks who are just sort of diving in or hearing about the lead and copper rule for the first time, I really highly recommend EDF, our colleagues at Environmental Defense Fund, have a series of blogs that they put out while the rule was being proposed. And since it was finalized, they do a nice job, I think, of explaining in pretty plain language. It's pretty quick to understand some of the opportunities and the challenges. So just putting a shout out and a recommendation that's a great place to start if you're feeling a little overwhelmed by all the technical information.
Thank you, Amanda. Anyone else?
I just, once again, I'm so excited to be part of this work. And, and from our experience in Flint, with crisis comes opportunity. We have this amazing opportunity now in this national moment of crisis to finally kind of respect science and protect public health. In Flint, something that we did after our crisis was really convene so many folks who are working and care about children. And we created something called Flint Lead Free, which, yes, I know we'll never get free, but it's in there. And it's a kind of holistic effort that really, in a data-driven way, looks at all lead exposure and looks at trends over time. So I'm including the link to our most recent report. We have landlords at the table and government folks at the table and state folks at the table. And we even worked with our friends at Alterum and at a city level also looked at the economic benefit of, the value of replacing all the pipes we've been able to replace and abating all the homes. And even at a city level, it's like $50 million, which is amazing. So as much as we can also kind of include that dollars in our work, I think we can better move policy.
Thank you so much. Anything from our Patterson team? Anything else you want to say?
We just want to say thank you for having us in this space. It's been wonderful to hear everyone's thoughts, and I'm loving saving all of these resources on the site as well. We're looking forward to a lot of them, and it's been great to just listen and share some thoughts on improvements that we feel can be made here and learning about some things that we hadn't considered.
Thank you all so much. I did want to mention that there's some questions coming in a lot more from early learning at the end. We have the Eco Healthy Childcare Program at the Children's Environmental Health Network, and there are a variety of different environmental health issues that we tackle through that program. Of course, again, lead is a traditional one, and we have a great partnership with the National Center for Healthy Homes, where for many years we've been working in home childcare facilities and now also center-based, and there is a lead prevention toolkit for childcare professionals. If we can get the link in, great, but otherwise just go to cehn.org and just drop down to our Eco Healthy Childcare Program under resources. But we'll try to compile a lot of these resources and get these out to you all because it's really great what's being shared here. So I want to thank everyone for your participation. Just in a quick summary, and there's no way I could summarize all the amazing talent and information provided, but Amanda started us off just with the overview. And again, that one first slide, I thought, well, you just hit it home with that. Data doesn't lie, no matter how many people may try to persuade you from thinking that what you're seeing is not happening. 23 million homes with lead paint exposures known, 6 to 10 million with lead service lines. And I didn't catch the last one with the early learning in schools. They're in the millions. It's a lot of exposure out there for our youngest and most vulnerable. The siloed traditional approach of addressing lead prevention versus other routes individually, it's gotten us a little bit, right? But it's nowhere close to the type of impact that we are all looking for, especially those of us and many before us who've been working decades of their entire lives on these issues. So where we need to be is addressing collaboratively in a comprehensive way the sources by looking at the highest risk areas first: homes, places of learning, other places where kids, in this case, are spending a lot of time, and pregnant women or women of childbearing age. The increase needs to focus on the structural racism that has been a part of the underbelly of this country, and a lot of the inability to get those that are the most in need what they really need and access to what they need. In this case, of course, lead being a very traditional example of that. We have an opportunity here to coordinate much more within the federal government, within our city governments, within our public health structure, our infrastructure, and that includes everyone that feeds into that community that is relying on public health. And if the COVID pandemic has not, again, exemplified that, then we all, I guess, have still a lot more work to do. The value of leadprevention.org, that was one of many wonderful resources mentioned. Again, the Lead Service Line Replacement Collaborative, that's another great resource as well. Dr. Mona also, her book is fantastic, by the way, What the Eyes Don't See. It's amazing. She didn't ask me to do that, but I highly encourage it as well. And all the other wonderful books that she put in the chat. So with her training, she was reminding us that even those that should be, if you will, in theory, informed on these issues, we cannot assume this, right? There's a lot to cover in public health. There's a lot to cover in protecting our most vulnerable. And she gave her own personal account of until she really started to see it in practice. And again, as a result, has now become one of our biggest champions in the country, and I know is viewed in the world as just an amazing champion. She acted though, right? She saw concern, and she started to act and started to realize, that wow, there are many routes of exposures for lead in this case, and water. Again, the one that you usually ingest, there should not be a concern. It's not like the child is sucking in many cases on a toy or some of the other sources of lead. This is something that we all need to, the ability to live and be healthy. And yet that simple right was totally and has continued to be stripped away from too many people still to this day. We have a board member, Mark Magana from Green Latinos, that says the fact that you even have to pay in many communities, they feel they have to pay for their water, which should be a right, is just a huge injustice right there. She reminded us that the symbol of lead, that lead actually means plumbing. So again, for us to be comprehensive in our thinking, not siloed, as Amanda was saying, that lead and water impact at the very youngest of ages. So that cognitive learning, the incredible window of development that we definitely do not want to miss and mess around with. This is where lead, especially lead in water and lead in paint for sure, impact the most. And she gave a great quote at the end of her talk from Renee Du Bois in 1969. Basically, I'm going to ad-lib saying that if we don't get our act together and look at what is before us as far as signs and opportunities to make a difference, then sadly, we deserve everything that we're getting. So I would add, whether that's COVID, whether that's climate change, whether that's, any of these things where we see precautionary examples of how we need to do better and be better. We cannot say that we don't have the science. We cannot say that we didn't know. We can't say we didn't even have partners to lean on. There's just a few right here, and there are hundreds across the country doing very similar, incredible work. Our Patterson team told us about a wonderful interactive lead registry map from data that they've had, and they were able to coalesce it. And you guys made it sound like, we just pulled the data. No. A lot of folks don't even have the data. So I just want to acknowledge, I think we all want to acknowledge, you guys are doing tremendous work, and we're going to do everything we can to continue to kind of be a blowhorn for this, because sometimes just collecting the data is the challenge, and then moving it and putting it in organized fashion, then an interactive map that folks can actually go and utilize, and the rest of us in public health can benefit from and share. That's incredible. We know it's still a work in process, but again, another example, you're working with your water company. Amazing, right? And that's an incredible partnership. And this map is also showing completed full line replacements. You're able to get that data from your water company, new construction homes, and also homes that have been inspected and to show no major routes of lead. So that's incredible. Again, I wish every city, my hope is that every city would have such a resource, and every homeowner would have such a resource. We also then talked about many things, including the COVID realities, that screenings have gone down. A lot of folks are very concerned about, bringing their children in for the type of lead screenings that they would normally have. There was a discussion in the chat about midwives, and I just want to bring healthcare professionals in general as well. I know that a lot more midwives have been even more busy, this year, because a lot of folks have been concerned about delivering in a hospital during a worldwide pandemic, so the cycles of challenge are vast. So we acknowledge that in public health. It has been hard before COVID. It's even harder. I think what all of us are trying to do is take a breath and really sit back and remind ourselves that we have a very unique opportunity here to squander, I guess, only if we allow it. We have some leaders that are in place that get these issues, that follow the science, and I acknowledge they need help. We have some funding, some capacity. We obviously always need more, but it's a good running start. Like Mona said, let's get into our discussions that are happening at the state level about how these magnitudes of money are to be spent, and make sure that they go for the immediate crisis, but also the long-standing historical concerns, so that we don't constantly get ourselves in a position of having masses of people highly at risk for many different public health ills and crisis moments. So with that, very excited to have you all. Thank you for joining us. We look forward to seeing you on the April town hall and the May one. And otherwise, please do reach out to any of us if we can be helpful in your day-to-day work, and appreciate all of you for what you're doing for all of our public health. Thank you so much.